Good morning, guys. So today in medical math, we are just going to start talking about medications. So with medications, you can have two different types. We can have either oral or parenteral, right there, those front two. Oral medications are kind of what it sounds. It's something that's taken orally, so it's taken by mouth. Ooh, wow, let's try that again. This can be pills, which are either tablets or capsules. Or in liquid form, like a syrup or something like that. A parenteral medication is one that is injected. I know that sounds really weird, but it's just an injection. So like a flu shot would be a parenteral medication, for example. Okay, intravenous lines are really fancy words for an IV. IVs are used to inject medication directly into a vein. So inject meds. This is usually like when you're in the hospital. A lot of times, like after surgery, IVs are used to administer pain medication much faster. Okay, drip sets. So pretty much it's just large drops. And the way a drip set is measured is how many drops it takes to make 1 milliliter. So for example, if I said it's a 15 drip set, that means it takes 15 drops to make the 1 milliliter. Okay, and drip rate is actually a formula. So it's the milliliters of total fluid getting multiplied by the drip set, and that is all divided by the minutes it's being infused. And we will need this formula later on in the week, so make sure we don't lose this. Okay, guys? Pause here if you need to keep writing. If not, come forward with me, and we're going to label a medication. So this is what a medication label would look like if you ever get prescribed like antibiotics, a low-dose painkiller, anything like that. So, for example, the trade name, first things first, will be the fancy name it's called. So there's A, trade name. The generic name is usually written right below it. So this is a fancy medication for aspirin. Okay, so we did A and B. The manufacturer, so it even says manufacturer right here on the label, so there's C. So pretty much the lab in which the medication is being made. The NDC, or the drug code, because everything has to be accounted for, is D right there. Okay, next E, my dosage strength. That's going to be right here on the sideline. It shows you how much of each piece of drug is inside, in this case, the tablet. F is my drug form. So right here it says it's tablets, so that's where F is going to go. Okay, usually underneath your drug form is the usual dose, but in this case it's underneath the strength. So there's G. Total amount enclosed, right here it says 150 total tablets, so there's my enclosure there, which is H. Any cautions on this drug would be right here in between C and A. So the caution, this one is it's a prescription-only pill. All medications do have an expiration date, usually located at the bottom, right there. And across from the expiration date is our lot or control number again. Everything has to be accounted for, so there's a code for everything. Go ahead and pause here if you need to. Let me know if you have any questions. If you're ready to move on, I'm going to move on to back in the day before doctors sent your prescription to the store, they actually gave you a piece of paper. So I'm going to show you what those look like. So back when doctors actually wrote out medications, this is what the paper would look like. Top of it should always have the doctor's name, the address, telephone number of where they're practicing, so where the doctor's office is. Underneath that, B should be who it's going to, the patient's name, and the address of the patient needs to be with it. And very important, the date that the medication gets prescribed. So A, B, and C, those are the top three things. Next is the medication name. So there it is. And the directions for filling the medication should be right next to it. So this tells the pharmacy that they need 60 40 milligram tablets. Directions for taking a medication right here is F, and I know this is in code, but it means take 40, so this PO means it's an oral medication. Why is my okay? Okay, so there's that. Okay, next there will always be 2 signature lines for the doctor, and that, depending which signature line, will tell the pharmacy what to do. So in this case, the doctor signed where a generic substitution is allowed. So he signed there. If the doctor did not want the patient to have a generic, they would have signed on the other line where it says dispense as written. So that just tells them, tells the pharmacy if they can substitute usually a more economical option for the patient. Refill instructions right underneath H. This medication has 1 refill allowed. If they circled NR, that means no refill. So it goes into the computer and tells the pharmacy that, if someone comes back for the refill, how many they're allowed, and it's recorded that way. The doctor's registration number, so every doctor has one to verify that they are truly a doctor and giving out medication to patients. And J is a label checkbox right there at the bottom. Okay, let me know if you have any questions on any of these labels. And if you're all set, go ahead and go on to the next page and practice identifying all these different parts and pieces.